Hello and welcome to the New England School of Homeopathy. Paul Herskew here. I just want to jump into Amy's discussion on the case that she presented last time on with a child that was diagnosed with oppositional defiant disorder, and just wanted to give some context. So starting in the early 80s, when we started studying homeopathy, we thought we were doing a great job. We thought we were learning everything, but then when we moved to the Midwest, we had tons of patients that were children. And we realized very, very quickly that the material that we learned just wasn't up to par, especially since most of the material that was written in homeopathy was about adults with very little about children. And what was written about children was 70, 80 years old and didn't really apply to the patients we were seeing currently. And so trial and error, many patients, and eventually we got to understand the remedies pretty well and how they relate to children. And so I wrote a book about that, homeopathic treatment of children, written getting on 20 years ago. Boy, I think nearly 30 years ago. And that was the most common remedies to be used in homeopathy for the treatment of children. And I'd like to think that that book was groundbreaking in a lot of different ways, and I'm sort of quoting the people that wrote reviews, in that what was unique about the book is that it really reflected what you see in practice, which was a little bit unusual in homeopathy, where the patients were describing as clearly as we can into the written word, such that when a student or a practitioner would read that book, the very next time they'd see a patient that needed that remedy, it was almost word for word. It was a really clear transition of dissemination of that knowledge. And then after a period of time, we started seeing more and more difficult children, more and more complex cases, and psychiatric and chromosomal and genetic disorders. And to the point that Amy's case starts to describe one of those kinds of cases where the psychological traits and the disposition of the child was very compromised. So at least that's one important feature of the New England School of Homeopathy. I think that we present information, present materia medica in a way that really mirrors what needs to happen in the clinic, what you see in the clinic, and what will help patients in the clinic. A second idea, a second concept of what this case exemplifies, and Amy touched on it in the middle of the paper, is that many cases, especially complex cases, there is no magic bullet in and of itself, by itself, that really, especially with treating children with ADHD and oppositional defiant disorder and comorbid diagnoses, it's a complex disorder with a complex treatment that should occur. I know in these years it seems very easy to either give a pill or decide to do this kind of therapy or that kind of therapy, this nutritional substance or that. But at least from the literature, and I think this goes across the board every time we look at literature, it seems that the multimodal approach is the best approach for treating children, which is both therapy, educational evaluations that mirror the learning style of the child, therapy for the family. And I think homeopathy is a very important part in that treatment as a modality, because I think homeopathy actually helps to unlock the key that makes all the other treatments work in concert.
Just to dovetail off of something that Paul was just talking about, we have often heard from patients that approaches that they've tried with themselves or with their children, regardless of what the problems might be, psychological, cognitive, physical, that didn't work, and they had failure with some of those attempts. Once they have a good constitutional homeopathic remedy on board, many of those treatment approaches will work better. So that's why we see ourselves as part of the healthcare team for our patients, and we will often say to them, that might not have worked a year ago, but you might want to go back now and try it again, because now that a remedy's on board and things are kind of humming along and the patient's doing better with whatever it is we're trying to help, many of those other treatments will work better. And we've just seen that over and over again in our practice. One of the things that we really like to emphasize in the NESH class has to do with only teaching what we see in practice. We're not interested in teaching things that are philosophically sound good, or maybe that we read somewhere 20 years ago. We really want to only put forth and bring forward those things that have been our experience over and again with patients in our own practice. And I feel like this is a very important piece, because we have made mistakes on the way, and you don't need to make those same mistakes. So one of our favorite students that talks about our work, who has been in practice for many years, talks about the NESH class being a kind of shorter cut to becoming better at prescribing homeopathic remedies. We can cut away some of the mistakes that are common in prescribing. So that's an important piece of the way that we like to work. Another thing I wanted to talk about related to this case has to do with what the feeling was like in the room. This was a whirlwind of a kid, and we are human beings as physicians, and we're human beings as whatever kind of practitioner you aim to be, and we are impacted and we are affected by the people that we treat. And sometimes this can be a very helpful clue to different kinds of remedies and things that we observe. And I've talked about this before, even just in this little countdown, around allowing our observations and our experiences and the way that we feel with the patient to help inform questions that we ask, because it's the right question at the right moment based on an observation often is something that's going to really open up the case for us and open up a conversation with either a patient or parents of a patient. And so really being tuned in during the case taking. And what Cycles and Segments gives us is a tool to apply right in the moment of case taking. So it's almost as if you have a funnel system, and once you start thinking in terms of segments, as the information from the patient is coming to you, you have places to put that information instead of being overwhelmed with seemingly disparate bits of information that's often part of case taking. Even when you're doing a very thorough, sort of typical case taking, getting the chief complaint and what things make it better and worse, and doing a review of systems, and doing your physical generals. And these are all things that, if this doesn't sound familiar to you, don't worry, we talk about a lot in the NESH class. But even doing those kind of things, lots of information can be coming at you, and whether you're taking notes by hand or you're using an EMR and you're typing, it can be very overwhelming if you don't have an organizational system. Most of us do better when there's some kind of organizational system in place, so the information that's coming through the time of the interview has somewhere to land and somewhere to fall, and somehow and some manner in which to be understood how the symptoms themselves relate to one another, and how they lead to one another, and how the person has gotten into this sort of what we would call a cycle of pathology. So I have found that the Cycles and Segments approach has liberated me from feeling totally overwhelmed when I'm with a patient who by nature is overwhelming. So any patient can be overwhelming, but then there are some that are even more so, and particularly a kid who's got a lot of energy going out in a lot of different directions toward violence, toward misbehavior, toward just difficulty, as this little girl was. And I feel like the results that we got from this remedy, this family had tried a lot of things with this girl. The results were really pretty impressive in not too long a period of time, and everybody could see them. So I've spoken before about this idea of having some objective observers helping assess our work. I had a patient today in the clinic. You can hear the birds in the background. We're sitting in our backyard on this summer evening. It sounds like some crows maybe. But I had a patient today who came in. She was a woman who had breast cancer a few years back, and actually did quite well with conventional treatment, except that she developed a terrible problem with her liver. They weren't exactly sure why, but one of the chemotherapy approaches that was used for her that was very successful against the cancer damaged her liver. And her liver enzymes were very, very high, and they were really concerned about the functionality of her liver to keep doing the important work that it does, and just if that was going to be something she would be able to live through, actually. And so we went to work on trying to do things to help support her liver. But the thing is, a lot of the naturopathic approaches we might use that are herbal, that might be related to some supplements, no doctors wanted her to do because they weren't comfortable and they were afraid they could actually hurt her liver. So we really were only working with homeopathy. And when we got the right remedy for her, the remedy that actually uses a very common liver remedy, lycopodium, although there are many others, her liver enzymes started going down very gradually. But I was also going on her mood, the irritability lessened, the gassiness and the bloatedness lessened, her anxiety about her health lessened. But what I really needed to see, I needed the objective proof that the remedy was correct. I needed to see the blood work. I wanted to see it every month, and I wanted to be sure that we were moving in the right direction, or else I was going to do something different. So just like with that little girl, I wanted the objective reports from the teachers and from the other people in their lives, the grandparents, and people that saw her outside the context of the family, not the mom only. The mom's super important, of course, the mother. But I really wanted some other objective input and information to make sure that what I was doing was moving us in the right direction. And I feel like this is a very important part of our job as homeopaths, not just to be making the assessments ourselves, gather and receive the outside information whenever is possible.
Great. Back to the case, the remedy Platina. First, just a small part of Platina, something you can use, I think, in the next days. And I can't really talk so much about a quick thing for Platina children, but for the remedy Platina, for somebody that hasn't really practiced a lot of homeopathy, one of the times you should seriously consider this remedy is if somebody has MS and their main complaint is numbness and tingling as the primary feature, not paralysis per se, not cramping or spasms, but where numbness and tingling is the presenting symptom, the primary symptom. And when they offer you the information in a very cavalier, boisterous, open, gregarious, loud manner, somebody that sort of presents that in that fashion, one of the main remedies that'll be quite useful is Platina, even where other symptoms that you might think of that remedy aren't necessarily evident at that time. Just if you consider Platina and start asking questions about it, I think you will often find that that's a very useful remedy in that state. Which jumps off to the next topic, which is when homeopathy was the prescribing of only one of 30 or 40 remedies, homeopathy was somewhat simple because every remedy was a little bit different or quite a bit different than every other remedy. But now with 4,000 remedies, many remedies are overlap with each other and have very similar symptoms. And if you have sort of a caricature of what that remedy is like, you're often going to miss the correct prescribing. And I think one of the highlights of our program is that we describe remedies in such a clear, detailed manner that it becomes much easier to differentiate one remedy from another, where historically that used to be quite difficult. And we hear this a lot from our students especially our students abroad that have been practicing homeopathy for 20 and 30 years, to be able to finally differentiate this remedy from this other remedy becomes it just eases their practice. That's just what we hear.
Mm-hmm.
So I think that's another strength of the program.
Mm-hmm. We are going to leave it there. We look forward to being back in touch in 2 weeks, and we hope that everybody has a healthy and happy couple of weeks.
And I think next time it'll be a case, or it'll be a paper presentation, and then after that we'll present another case with video.
Yeah, that sounds like the plan. Okay, take good care. Bye-bye.
Bye-bye. Have a good rest of the summer.